Hello, everyone. This is Dr. Hassaballa coming to you live from the hospital with another episode of Healthcare Musings podcast. I wanted to reflect upon the whole issue of DNR. DNR, for those who don't know, means do not resuscitate. And what this means is if a patient's heart were to stop or were they to stop breathing, we would reflexively start CPR, which is external cardiac massage. So we push hard on the chest from the outside to squeeze the heart externally because the heart has stopped beating. And then we would typically breathe for the patient with a mask and then usually put a breathing tube in the throat to help accomplish breathing. CPR is violent. It is not clean and nice like it is depicted on television. It breaks ribs. It collapses lungs. It's very painful for those who survive it. So when we put an order, do not resuscitate, that means if the heart were to stop or the patient would stop breathing, we would not do CPR. We would not deliver electrical shocks because sometimes when the heart rhythm is dangerously erratic, we will deliver an electrical shock externally to reset the heart and then put a breathing tube in if they stop breathing. So all of these things will not be done if a do not resuscitate order is in place. Now, for someone who is relatively young and healthy, who collapses at home or collapses at a baseball game or a gym or somewhere else, and CPR is started right away, and EMS is called, and they respond right away, there are good outcomes. Patients can survive cardiac arrest. Many times, dare I say most times, when a patient suffers cardiac arrest, they don't have good outcomes. They do not survive and be the same person that they were before. Even in patients who have a good outcome, sometimes there are subtle neurologic issues, but they, for the most part, can function. Many times, they can't. The brain can only tolerate a few minutes at best without blood flow before permanent damage ensues. And so, unless you're right there when someone suffers cardiac arrest and you do good CPR immediately and EMS is called and they take over and establish return of spontaneous circulation immediate or very soon thereafter, it's very difficult to get a good outcome with CPR and resuscitation. And so for a lot of patients, knowing that information, they elect to be called a DNR, meaning do not resuscitate. If the heart stops, um, we will not do CPR, we will not shock the heart, we will not put a breathing tube in. DNR has sort of a connotation, I've seen it with a lot of people, that we don't care, that we no longer care. Oh, he's DNR, so we're not going to take care of them, or we're even going to neglect them, or not do anything to make them get better. And it seems almost callous. I mean, it's a technical term. It just seems callous. It has a callous connotation sometimes. And what are we doing when we sign a DNR, when we order the patient not to be resuscitated in case of cardiac arrest? What are we doing? We are actually allowing for natural death. We're allowing a patient to die naturally, succumbing to their illness with dignity and comfort. And I've seen some institutions across the country not use the term DNR, but actually use the term AND, allow for natural death. And I think this should be more widespread. I like it. Um, Because what we are doing when we do a DNR or we allow for natural death is we give the patient the dignity of a good death. I know for a lot of people, especially when you ask them, do you want to die with us pounding on your chest and shocking your heart? Many, if not most, will say, no, I don't want that. For me personally, I don't want that either. So now, of course, if I suffer cardiac arrest, I would hope someone would do CPR and try. And at the same time, if I have chronic illness, incurable illness, and resuscitation is only going to worsen the burden of the disease process and prolong my suffering, then I would not want to be resuscitated in case of cardiac arrest. I would want to be allowed to have a natural death. And I really think we should expand the use of A&D, allow natural death, because it more humanely explains what we're doing when we order a DNR. I like to say that if despite everything I'm doing, your heart stops or your family member's heart stops, that's God telling me he wants you back or he wants the patient back. And who am I to stand in the way, pounding on the patient's chest, shocking their heart, and jamming a tube down their throat? That's almost the size of a garden hose. I, I think that is a better way to explain what a DNR is. We are allowing for the patient to have a dignified natural death. And um, I think we should think about changing the terminology from DNR to A&D. Thank you so much for your time and attention, and see you next time on the Healthcare Musings podcast. So long.